Good afternoon, everybody. Welcome to this month's webinar, Living with CMT Exercise Recommendations. You're going to be hearing from some very talented people who focus on Charcot-Marie-Tooth, and I think you're going to find this very interesting for the next hour. Having said that, I will turn it over to Dr. Sabrina Paganoni and therapist Katey Burke and Amy Swartz. Ladies, it's all yours.
Thank you. Thank you for the kind introduction, and thank you everyone for joining today. My name is Dr. Paganoni, and I work in Boston, Massachusetts at the CMT Center of Excellence at Massachusetts General Hospital. I'm delighted to be here today with our PTs, Katey Burke and Amy Ellrodt. They have extensive experience working with people with CMT, so we will share the presentation. And we're happy to talk to you about exercise in CMT. Several people have asked us about it, and several medical societies have declared that exercise is medicine. But if exercise is a medication, one needs to get the right type and dose. So what is the right type of exercise for people with CMT? Ahead of the webinar, we have received lots of questions about exercise in CMT, and we will try to address all of them during the webinar. So people with CMT have told us that they want to improve their strength and mobility. They want to maximize their independence and enjoy great quality of life. So can exercise help? Well, yes, exercise is one piece of the puzzle and can help you achieve your goals. Some people may actually need additional tools, such as braces or assistive devices. And the objective here is to use all available tools, including exercise, to achieve the goals of maximizing strength, mobility, independence, and quality of life. When I meet with people with CMT, they often ask me these questions. Will exercise help me get stronger, or can it hurt? What types of exercise are best for me, and how much and how often should I exercise? So now today during the webinar, we'll first have our PT, Katey Burke. She will speak first, and she will provide a detailed review of the scientific research that can help answer these important questions. And then after Katey, we will hear from Amy Ellrodt, who will unpack the science for you and provide you with a practical toolkit that you can use to exercise moving forward. So Katey?
All right. Thank you, Sabrina, for that introduction. And I just want to start with a disclaimer that while we try to answer this question, the recommendations that we'll be giving today are general recommendations. And for each individual living with CMT, the way to best find an exercise program for you would be to consult with a physician and your physical therapist to individualize a program for you. But we will try to use the evidence and our clinical experience to answer some of these questions. So the first question is, should I exercise? And overall, there is limited evidence to help answer this question. There are small studies that are usually moderate quality, but I think I wanted to start off with this study done just last year, which was a retrospective chart review of about 300 patients with CMT, and they looked at back in the charts to see self-reported exercise and strength, and they found that those who reported that they were exercising were stronger. So now looking more specifically, is strengthening good for me? And here I have 6 studies to quickly go through. Going back to 1995, a study with 30 individuals with Charcot-Marie-Tooth. They exercised 3 times a week for 24 weeks. And the exercises were focused on knee flexion and extension exercises, as well as some hip exercises. And they did find some modest strength improvements as well as some functional improvements in this study. Another study with 20 participants, again, 3 times a week, this time only 12 weeks, used ankle and wrist weights for elbow and knee exercises. And they did find improvements in activity of daily living participation and performance, as well as some modest strength gains. This next one was 18 participants. Again, it was 3 times a week, 12 weeks, similar exercises. And in this one, only the chair rise time improved, but still a functional improvement. Burns looked at one individual with CMT, and for this one, they were looking specifically at ankle dorsiflexion and strengthening the muscles that pull your foot up. And unfortunately, did not find any strength gains when targeting those muscles and no functional gains either. Moving on, 32 individuals exercising 4 times a week for 16 weeks, focusing on the hip flexor exercises, since the hip flexors were found to fatigue with activity. And here, there were some improvements in the left hip flexor strength, but it didn't translate into functional improvements. And then the last one was, again, last year, 60 participants, so slightly larger and younger individuals, so ages 6 to 17. They, for 3 times a week, 24 weeks, worked on ankle dorsiflexion exercises and a progressive exercise program that built from 50 to 70% of their 1 rep max versus sham group that didn't have that progressive built into it. And they did find that at the 24-month mark, progressive resistance training produced an overall gain in dorsiflexion strength compared to the deterioration in the sham group. So some recommendations, and we'll go into much further detail later in the presentation for this, but for the strengthening, there's still limited evidence, but it looks as though moderate intensity strengthening can be beneficial, and focusing on muscles that are not heavily affected by the CMT will be more effective. Those that are heavily affected by the CMT will not regain strength. And from that last study, starting a program early with children or teens may help attenuate the disease progression. And for most of the studies, the frequency was 3 times a week. Moving on to aerobic exercise, this had even fewer studies, but going back to 1984, there were 2 participants with CMT who did a program 3 times a week for 12 weeks. It was a cycling program. And there were no significant improvements in their VO2 max. They did find that heart rate increased for these 2 participants, but it's such a small study, it's hard to gain much from this. A slightly larger study in 2011 had 8 subjects with CMT compared to 8 healthy controls. Their program was 3 times a week, this time for 24 weeks. And again, it was a cycling program with intervals. And they found improvements in aerobic capacity as well as functional improvements with the aerobic training. And last year, this study published with 10 subjects with CMT. Unfortunately, 5 completed the study. And this was looking at the anti-gravity treadmill, which is really becoming quite popular. And they either did walking or running 3 times a week for 30 minutes at 70 to 80% of their heart rate max. And within those 5 subjects who completed the study, they did find improvements in postural control with some trends towards improving walking and aerobic conditioning. But with the dropout, the power of the study was quite limited. So to summarize the aerobic training recommendations from the literature, very limited research. We do know from the general population that aerobic training has many cardiovascular benefits. The 2 of the 3 studies did include cycling, which may be beneficial, and then the more recent one with the anti-gravity treadmill, which really needs more research at this time, but is worth considering. And there are many other modes for aerobic training, including pool therapy, which can be quite beneficial. Moderate intensity is recommended. The high intensity may affect compliance or tolerance, which may have happened in that last study. And here, frequency 3 times a week for at least 30 minutes. Should I spend time on balance exercises? And to answer this, I guess we want to know if balance can actually improve. So we have a few studies here, each case studies. The first one is an adult with CMTX who completed a 3-week individualized rehab program. It's a pretty intense program that included quite a few different balance components. And his balance improved in a number of different tests that they looked at. The 9-year-old boy with CMT1A in the next study did exercise training 3 times a week for 5 weeks, focusing on ankle exercises, and then use the Connect system to do different balance exercises. And his balance and endurance also improved, strength did not. In 2016, the now 14 participants with CMT 1A, this study, they actually looked at using mechanical vibration to the quadriceps and the gastroc soleus and looked at how that affected balance. And I included this because in the study, the Burke balance test and dynamic gait index did improve. So it shows that balance can improve with training. And then we need to think about what other modes or what else we can add to this training to maybe improve those gains. And then there is an ongoing study right now in the UK, which is looking at a 12-week program with multisensory balance training and strengthening exercises. And I'm hopeful that this will provide us more insight on balance training, figuring out what programs may be most beneficial. So from the literature, it does seem like balance can improve with training. And as I'll show in a few slides, mixed programs have been shown to show balance improvements, and more research is needed to determine the most effective programs. I have one slide here on stretching. I found that for most individuals I work with CMT, we really don't need to convince you that stretching is beneficial, so I didn't want to spend too much time on it, but this does show that there are many benefits of stretching and really a lifelong habit that anyone with CMT needs to get into, and stretching key areas down at the feet, the ankles. This can include passive stretching. Daily standing is a great way to stretch out the ankles, splinting, and active mobility. Is a mixed program better than focusing on one type of exercise? And these two programs were both mixed programs. The first one is quite an intense program, 6 times a week for 2 weeks and 40 minutes each day. And it included the stretching, strengthening, balance training. And they did see functional improvements, balance improvements with that program. The second one was only twice a week, and this time for 8 weeks, but 90-minute sessions with treadmill training, stretching, respiratory training, and some proprioceptive exercises. And here they did see improvements in the ankle range of motion and some functional improvements. Importantly, in this study, when they did a 6-month washout, they found a regression back to the baseline state, which really advocates for frequent check-ins with a physical therapist to modify or update a program. Many people ask, should I be concerned about overwork weakness? And so I pulled 2 studies that have controversial findings. The first one had 106 individuals and with CMT compared to the healthy controls, and they found that they were comparing the intrinsic hand muscles between the dominant and non-dominant sides. And they found that in the individuals with CMT, the non-dominant side was stronger for most of them as compared to the healthy controls, where most of them, their dominant hand was stronger. So this suggested possible overuse weakness of that dominant hand. Then a couple years ago, a larger study with closer to 300 individuals with CMT1A, and here they looked again at the hand and some of the lower leg muscles between the dominant and non-dominant side. And in this study, they found relative symmetry throughout the disease process, and that it didn't change as people progress through their disease. So they argue against the overuse weakness theory. These studies, it is controversial. We definitely need more evidence. We don't know if either study actually tested for true overuse in these muscles. And we do believe that high intensity exercise can cause the overuse, so we discourage that. And for now, our recommendations, if you have any signs of overuse, which could be increased weakness, fatigue, cramping, stiffness, or decreased function, that your program should be modified. All right, so now I'm going to pass it over to Amy Ellrodt, who will be going over more practical recommendations from that literature.
Hello, everyone. So now I'm going to take what we learned in the literature and sort of what we do in our clinic and give you some practical recommendations about exercise. There are 4 sort of modes of exercise that come together to make this whole puzzle work. And these are the 4 things that we generally tell our patients to focus on. And those are balance, stretching, strength, and endurance. So when we talk about strengthening, we know that because the nerve muscle combination isn't working well in the muscles that are directly affected by the CMT, you can't build up those muscles. So you can't build strength or muscle mass in the muscles that are very affected by the CMT. But however, there are muscles that may be weak that are not directly affected by the CMT, but that may be weak due to disuse. And those muscles can be strengthened. And so what we're looking for is for those muscles to be strengthened, and then they help compensate for the CMT-related weakness in the other muscles. We generally recommend gentle toning exercises, what we consider sub-fatigue moderate exercise, which means exercising so you feel like you're getting something out of it, but so that you're not overly fatigued when you're done. And to do those 2 to 3 times a week. We tend to recommend that people focus on the core and hip girdle. These are muscles that generally aren't as affected by CMT, and they're areas that are good to target for toning in most people with CMT. We usually discourage heavyweight, high-intensity training. We really feel like this should be avoided. And you shouldn't work through any pain. So you shouldn't have pain while you're doing the exercise, and you also shouldn't have pain after the exercise, and that includes muscle soreness that extends into the next day. So when we talk about strength training, we talk about focusing on the larger muscles, functional muscles, and functional training. Core stabilization and hip strengthening are great exercises. They help with balance as well as many functional activities. Those are the muscles that kick in when you're standing. Those are the muscles that help you climb stairs, that help you get out of a chair. Many of our patients also find Pilates helpful, and we usually recommend focusing on functional body weight exercises, such as some of these shown here. And really the focus should be on strengthening the muscles that are not affected by CMT, and keeping the weight light, not exercising a given muscle until it's so fatigued that it can't do anymore. So in terms of endurance training, which is what we think of as aerobic exercise, we recommend about 20 to 30 minutes at least 3 times a week, and finding something that you enjoy and that's also safe. For example, taking into consideration any balance challenges you have, perhaps a stationary bicycle or an elliptical machine may be safer than walking on a treadmill where the surface is very narrow and it's also moving. So we find that cycling, the elliptical machine, the machine on the top right here is called a new step, which is like a seated step machine. Things like cycling, both outdoor and stationary, using the arm bicycle, and different types of aquatics, swimming, aquatic exercise, and walking in the pool can also be helpful and tend to be safer. They're lower impact, so they're better on your joints. Oftentimes, patients find that walking with balance walking poles is helpful. You get functional walking in and good endurance exercise, but you have the balance poles to assist you with your balance. Specific considerations for aquatic exercise include the temperature of the pool. A warmer pool will be easier for your muscles to move around in than a cold pool. Safety getting in and out of the pool, making sure that the pool has an easy way for you to get in and out with handrails. And also choosing shallower water if you have shortness of breath, and being underwater to your chest might make you more short of breath. For balance exercises, what we recommend is choose a couple exercises and do them every day. There's so many factors that go into balance. It includes strength, it includes sensation, it includes proprioception, which means sort of knowing where your joints are in space. It includes your vision. So working on balance works on all of these things. So we tell you, choose a spot somewhere ahead of you and focus on it. For static exercises, either stand in a corner or have a chair or a counter in front of you in case you do need to hold on to that for balance. And then also try to incorporate functional walking activities into your balance program. The ideal program is to work with a PT to individualize a safe program for you and then to continue to do that program on your own. Sometimes patients also find that bracing, including ankle bracing, may help to improve balance and allow them to do more advanced balance exercises. And we encourage that. The more you can do, the more your muscles and your body's going to get out of it. So fall prevention is always a discussion we have with our patients as well, due to, obviously weakness in the ankles and feet and balance issues. Many people with CMT have falls, and our goal is to keep you from falling. So working with your PT to optimize your balance through balance activities is really important. Doing things at home, such as picking up throw rugs because they're a trip hazard, or taping the edges of a rug so that you're not tripping on it with your foot. Keeping areas well lit, having a night light if you need to get up and use the restroom at night. And also using bracing as needed. Ankle foot orthoses, ankle braces can really compensate for ankle weakness and also for decreased proprioception. And we find that the bracing technology has come a long way in the last 10 years or so, and the braces now are more supportive than immobilizing. And there's some evidence to show that wearing AFOs and being able to do more functionally actually helps to strengthen the muscles higher up in your legs that are less affected by the CMT. So we find that can be really helpful for fall prevention and also for increasing your strength and function. Use an assistive device as needed to prevent falls. Maybe a cane would be helpful, or a walker. Some patients only use the walker when they're home at night and need to get up to use the restroom. Balance walking poles are also very helpful. And seek out adaptive equipment for specific tasks. There's a certain thing called a go-go stick that helps clean up after your dog. There's also many devices you can find online and in stores that can help make functional tasks easier and safer. So as we discussed before, stretching is something that's almost universally recommended, and most of our patients that we see are doing some stretching because everyone realizes how helpful it is. The best way to do the stretching is to hold each stretch for 30 seconds and repeat 2 to 3 times on each side. It's best if you can do the exercises every day. Some people choose to do them before they get out of bed in the morning. Some people choose to do them before they go to sleep at night. If you can find a time that works best for you and do them daily, that's when they work the best. Stretching can help with a lot of things. It can help decrease pain. It can help you from losing range of motion. It may help maintain your range of motion, and that helps also with function. So the areas we tend to focus on that tend to get tight in people with CMT are the ankles and feet, hip flexors, which include your quadriceps and the higher up hip muscles, and also your hamstrings. And the other 2 areas that we recommend people focus on stretching are shoulders and hands. So hands, we get a lot of questions about hands, hand strength, hand function, how to be able to do things easier. If the CMT has directly affected hand strength, you usually can't regain the strength in your hands, but it's important to stretch your hands regularly to maintain the range of motion, because range of motion is very connected with function. Some patients benefit from resting hand splints to wear overnight so their fingers don't get curled overnight. And an occupational therapist may be able to make functional splints to help with specific tasks. For example, some patients use functional splints to help with holding a pen or toothbrush. The use of adaptive equipment as needed really makes your life easier, and it allows you to do more things. And an OT can recommend those. There are also different websites and stores that carry adaptive equipment. One of the big things is that exercising should be fun, and you should find something that you like and you enjoy. There are many adaptive sports programs all over the country. So here in Boston and our New England area, Spalding has a tremendous adaptive sports program. There's a program called Access Sport America, Capable, CMT Athletes Program. There are other community programs. A lot of ski mountains have adaptive skiing. You can search by state if you go online and find adaptive sports programs. A couple of the questions that we get are what to do if you have pressure sores on your feet. And first of all, you want to do whatever you can to let them heal and not aggravate them. So take the focus away from your feet when you're exercising. Focus on hip, core, and arm strengthening, stretching your hips and arms, and use the arm bike rather than the foot bike for aerobic conditioning. The other thing I would say is, try to figure out where those are coming from, and if you are wearing braces, if they're contributing, making sure that you get those braces adequately adjusted. Another question we get is if you have cardiovascular limitations not related to CMT. And we really recommend that you speak with your physician and work with a PT to develop a safe program. Each person is different and each person has different limitations. And if you are limited by breathing, you really have to use your breath or your shortness of breath to determine when to take breaks. The talk test means that whenever you're exercising, you should still be able to talk. If you're so out of breath that you can't talk, that means you've pushed it too far and you should back off and take a break. Pacing, which we talk about with everyone, will be even more important for people with CMT. And if you do have shortness of breath and you're exercising in a pool, it may be beneficial for you to stay in shallow water so that the weight of the water isn't pushing in on your chest. So the way we look at it is if you can take 5 minutes a day to do balance and stretching every day, so pick one balance exercise a day and stretch both of your legs, it lasts about the length of your favorite song. So we're trying to find ways to sort of sneak the exercise in there and make it fun for people and make it so that it's reasonable for you to do it every day. So 3 times a week, do some strengthening. It doesn't need to be anything complicated. You can do body weight focused strengthening of your core and hip girdle, and then some sort of endurance training, whatever you choose that you enjoy for 20 to 30 minutes. The best way to do this is to design the plan along with a physical therapist that has experience with neuromuscular diseases. And then you may not need to meet with that physical therapist very frequently. You just want to meet with them periodically to review the plan and modify your program as needed. So again, we just want to make it so that you find a way that you enjoy it and exercise is fun and it's not a chore. So where to start? The first thing to do would be to meet with a physical therapist to determine your current abilities, what specific limitations you have, and then develop a safe and individualized program for you. Each person is different and each person has different symptoms and different things that they want to work on. There's not one program that really is best for everyone. So there are some other resources available. For example, there's a CMT exercise video series that's available on the website. And there are 6 videos included in that series. There's an ankle balance and proprioception video. There's lower leg strengthening. There's improving mobility through leg strengthening exercises. There's building core strength to improve balance and stability. There's a stretching video, and there's one that focuses on hands and fingers. Additionally, there's a Pilates video series that's also available, and it includes 4 videos. The first one is what is Pilates, so it explains the theory of Pilates, the introductory video. The second is the pectoralis major and minor. There's a shoulder movement video and a shoulder roll video. And there's also a video series about balance walking for CMT. Balance walking is also called Nordic walking, and it's walking using these balance poles. And so there's 3 videos in this series. The first one is what is balance walking, and the second one is simple steps to success, and the third one is stretching and breathing with the balance walking poles. Thank you very much for listening today. And I'll pass it back over to Bob.
Thank you very much. I appreciate it. I just want to say that those videos are available on the cmtausa.org website. If you just go to the little search icon in the top, you'll be able to search those videos and find them very quickly, actually. There's a couple of questions that came in. Maybe you guys can help answer that I don't think we touched on during the webinar. One of them first was, do you know of any diaphragm muscle weakness? I know you mentioned breathing, but particularly related to CMT and how it affects your exercising?
Hi, this is Dr. Paganoni. Yes, there are some forms of CMT that are associated with diaphragm weakness. That's not going to be the majority of people with CMT. Actually, it's only going to be, a minority of people. So if that's the case, definitely you'll need to consult with your pulmonologist to determine what level of exercise is safe for you. For all other people with CMT that do not have diaphragm problems associated with CMT, again, the same precautions apply. What Amy and Katey have been discussing, you'll need to discuss with your physician and PT whether there may be additional limitations.
Thank you, Sabrina. Appreciate that. There's a couple other ones that I don't know, Amy or Katey, if you're familiar with water therapy. Could you go into a little more detail? Do you know how that works and what kind of exercises are good if you're, you have that available to you?
Sure. I mean, I think we see, I would say, 3 different types of water therapy. One is group classes, like group water aerobics. And those are situations where anyone, whether you have CMT or not, you have to sort of go to the class and sort of monitor what you can and cannot do safely. Often talking to the teacher ahead of time is really helpful, just to let them know that you may have to adapt some of the things. Usually the instructors are very good about adapting things. The second way we see water therapy is one-on-one with a physical therapist. And that usually happens in a therapeutic pool, which is a little bit warmer and almost always has an accessible way in and out. And that's actually physical therapy that's done in the water. So they develop a personalized exercise program for you based on your needs, and it's just done in the water instead of on land, utilizing both the buoyancy and the resistance of the water to do an exercise program. And then the third way we see it is patients that do independent exercise programs in the water. Some patients are swimmers and they want to continue swimming. I have several patients that have found places that have 3-foot deep lap lanes, and they'll walk in the lap lanes of the pool. The water comes up to about waist level. The resistance of the water gives you a little extra exercise, but the buoyancy of the water decreases your risk of falling. So we see patients that do all 3 of those, and they're all beneficial in certain situations as long as it's something that you, A, enjoy, and B, it's safe for you to do.
All right, thank you. One comment about the swimming. I am a swimmer myself, and my hands are fairly well affected by my CMT. And I have a pair of gloves that I got from, I think, Speedo or one of those companies that you slip on, and it really makes moving through the water a lot quicker and strengthens the workout for my shoulders and stuff, because it's hard to cup my hands in the water. So if anybody's into swimming, that's one way to get your arms a little bit more activity that way. Another question that came in, something about CMT and hip dysplasia. Sabrina, maybe do you know, or Liz, do you know if there's any connection directly with that, or is it just maybe a side effect of what happens?
Well, whenever you have a neuromuscular disease that starts, very soon after birth, and affects gives you weakness in the lower body, that can be associated with it. That's not going to be most people with CMT. That's only going to be those people that have sort of a more early and more severe presentation. So again, I would say that would only apply to certain situations.
Okay. And we have a couple questions about muscle cramping. I don't know if that, again, comes on from exercise. They haven't mentioned if it was from exercise or just general muscle cramping. Any advice on dealing with muscle cramping?
I would say there are definitely some patients who have found that specific exercises can cause cramping, and for those people, I'd say let's find some other exercises so that you're not cramping as much. I've also found that people who are more diligent with their stretching, or maybe do a lot of stretching before the exercise, and if they're having cramping at night before going to bed, that the stretching can help quite a bit to relieve that cramping. If you guys want to add anything.
All right, thank you. So one other question, people are curious how to talk to a physical therapist about CMT. There are people, quite a few people here who mentioned that the PTs they visited with do not know anything about CMT. So what's the best way to explain this to somebody in like a quick way, get them up to speed?
So I would say we spend a lot of our time here trying to connect patients with the right physical therapist. So I think that's part of it, is that, you know, in many situations, there is a physical therapist somewhere in a hospital or rehab hospital or facility that has experience with CMT. And in some situations, there's not. And I think the key is sort of explaining it to them, directing them to resources, for example, directing them to the CMTA website. There is information on that website that is applicable to physical therapists that's, you know, in depth enough that would help them to understand what's going on with disease and what to expect.
And I would also say that your publication, I believe it's quarterly. You know, I received that and I always read it with great interest. I think there's a lot of great articles from the CMT Association. So in addition to the online version, there's always a lot of great articles, and some of them are written by PTs who have experience with CMT and could be a useful resource, you know, for you to contact them or share the articles. So I would say, you know, there's a lot of opportunities out there to connect your local PT to people who have experience with CMT. And I would imagine that PTs who have not had the experience of working with people with CMT would actually love to learn and read, and you can also share some of the articles that Katey mentioned before. Again, I think I'm pretty sure that they would love to learn more and connect with people who have experience.
Yeah, and along that line, thank you for mentioning the publication. You can also ask questions, write in questions to that can get answered. And also, you know, search the website. The website is always updated with the latest information. And as I said, the videos that Katey and Amy were talking about are up there. So I think that's all the questions we have for today. I want to say thank you very much to the three of you for spending your time. This was, I think, really helpful, really well-attended webinar for us here. And so thanks for cutting an hour out of the middle of your day for this. And I'll let you guys close with any closing comments that you have.
Thank you for this opportunity. You know, we really value the CMT Association, and we are always happy to connect with the CMT community. And I think there's a lot of great expertise, and either online or with, you know, publications. And, you know, we're always wanting to connect, happy to connect. And I think, you know, there's a lot of helpful information for everyone to share. We also welcome any feedback. I think your comment, Bob, was very valuable. I mean, we do learn all the time from people with CMT, and some of our comments and you know, some of our slides were actually informed by people who live with CMT and can teach us as well. So we're really always happy to collaborate.
I think with that, we'll say thank you very much. We hope you all have a pleasant afternoon.
Great.
Thank you.
Thank you.